ashver.com.
Hello, welcome to ashver.com. You are watching interesting video on Am I Pregnant? How to confirm if you are pregnant. Please read the disclaimer carefully. If you're trying to conceive, there is no doubt at all that you're on edge every month waiting for about 2 weeks between your ovulation and your menstrual period. Anyone who's been there will understand completely that what you really want is a positive pregnancy test and the right to tell everyone of your coming baby. All mothers have been there at one point or another, but most people who've had children will also be the first to tell you that the best way to know if you're pregnant is to wait for 2 weeks and then take a pregnancy test. You probably don't want to do this, and that's understandable. Nobody likes to wait, and most people aren't especially patient, especially when waiting for something they really want. This article lists some common early signs of pregnancy which may alert you to the possibility that you're pregnant. Before continuing, a primer on the human fertility cycle. In the time that I've been writing about pregnancy, I've received a number of questions asking, am I pregnant? Unfortunately, in many of these cases the woman is asking me if she's pregnant within days of her last period, or before she's had a chance to implant. To help avoid these questions in the future, and the risk of anyone feeling silly, I'd like to inform you of how the female fertility cycle works. This will help you to know when to take a pregnancy test in the first place, and when to be worried about your period not appearing. A woman's fertility cycle comes in 4 distinct phases, beginning with the menstrual period. You should be familiar with your period, as most women experience them roughly once a month, and we're assaulted by commercials advertising materials to help with hygiene during that time of the month. A period generally lasts between 3 and 7 days and is varied. Its length may change from cycle to cycle. The second phase of the fertility cycle is the follicular phase. As with the menstrual period, this phase is varied in length and may differ from month to month. This phase lasts until your ovulation, which occurs on a single day around the middle of your cycle, about a week and a half or so after your menstrual period, depending on individual variations. The third phase of the fertility cycle is ovulation, which takes place on a single day around the middle of your cycle. Ovulation is an event in which the ovary releases an egg into the fallopian tube. The egg may then be fertilized, resulting in implantation and then pregnancy, or not, leading to menstrual period. Finally, you will experience the luteal phase of your cycle. This phase lasts about 2 weeks from ovulation to menstrual period. The luteal phase is fixed, meaning that it will be the same length every cycle. For example, if you have a 17-day luteal phase, you should be able to predict that if you note ovulation, using a testing kit or temping, on the 2nd of February, your period is then due on the 20th of February. Implantation occurs roughly 10 days following your ovulation, regardless of the date of sexual intercourse. You may implant between 8-12 days following your ovulation, and before this point, your body hasn't yet begun to produce the hormones that tell your body you're pregnant. In other words, you will not experience pregnancy symptoms until after the embryo has implanted on the uterine wall. None of the symptoms listed on this bill indicate pregnancy until after that point, and you won't get a positive pregnancy test until after implantation. If it's less than 10 days since your last period, you're not pregnant yet. What I'm trying to tell you is that you won't know you're pregnant until you get pregnant. This really ought to be obvious, but it bears stating again and again. Once you're pregnant, you can take a home pregnancy test and should get a positive result. If your hormone levels are high enough to cause symptoms, they're high enough for you to take a test and, hopefully, get a positive result. The goal of this page is to help those women who are waiting out the last 4-6 days before their period is due in order to take a test. Encouragement is the sole purpose of this article. You won't know for sure that you're pregnant until you have your blood tested by a doctor, and you probably won't believe it until you see the baby on the ultrasound screen. Early pregnancy symptoms, the head. The most commonly overlooked symptoms of early pregnancy start in the head. These are also perhaps the most obscure pregnancy symptoms and the hardest to determine whether they are pregnancy symptoms or perhaps symptoms of something else. Two common head-related symptoms of early pregnancy are listed to the right. They are both fairly simple and straightforward in terms of symptoms, but for many women, these could be anything. Is a stuffy nose a symptom of pregnancy? It can be, yes. When you become pregnant, your blood oxygen and blood flow increase, and this may cause swelling of the nasal passages, producing a stuffy nose. You should observe whether or not your nose is clogged with mucus or if it is swollen nasal passages, as excess mucus could be, instead, a symptom of a cold. What about headaches? Headaches are also caused by the increased blood supply and flow during pregnancy. This puts pressure on the nerves in your head and causes discomfort. If you think you may be pregnant and you have headaches, talk to your doctor about which medications are safe for use during pregnancy. Early pregnancy symptoms, the senses. Your senses may be the most definitive way to predict whether or not you're pregnant, without taking a test. Two common sensory symptoms are listed to the right, and you should be aware of both of them. In particular, a sensitivity to odors may indicate pregnancy. If you're feeling as though you can't smell strong smells without feeling sick to your stomach, this is a strong sign that you may be pregnant. Additionally, you may wish to determine whether you have a metallic taste in your mouth. Metallic taste in the mouth, also known as dysgeusia, is most likely an indication of pregnancy and is caused by hormonal surges which also alter your sense of smell. Early pregnancy symptoms, abdomen and torso. While the metallic taste in your mouth is your strongest indicator of early pregnancy, there are other symptoms that are most commonly associated with pregnancy. You probably already know about these, but they always bear mentioning again. This one is the most unusual. Dark blue veins in the breasts may indicate pregnancy. It could also indicate any other condition which causes increased oxygen to the blood, which is what causes the veins to become more blue. Usually these blue veins are also puffy in the breast area and in the nipples. You may also notice darkening of the areola during early pregnancy, so pay attention to your breasts. Implantation bleeding and/or cramping may occur 8-10 days after ovulation. If you know when you ovulated and you experience cramping or bleeding earlier than 8 days post-ovulation, PO, it's probably not implantation bleeding. Finally, what many women think of as the most obvious sign of early pregnancy, morning sickness, indicates early pregnancy. You won't experience morning sickness, or other symptoms, until after you've implanted, so this will begin to occur shortly before your missed period, and may be combined with your increased sensitivity. Early pregnancy symptoms, other areas of the body. Early pregnancy causes frequent fatigue, mainly due to the fact that your body is working on growing another person. Fatigue can be caused by a number of other factors, however, and therefore cannot be counted on to indicate whether or not you're pregnant. Rely on other symptoms before you rely on fatigue to predict your pregnancy. Your missed period is the single strongest indicator that you're pregnant, bar none. If you miss your period, take a pregnancy test, because you're probably pregnant and should be seen by a doctor or midwife, if you're choosing to see one during your pregnancy. If you think you're pregnant, test. The only way to be 100% certain you're pregnant is to take a home pregnancy test. It's recommended that you wait until your missed period before testing, as this is the most likely time that you'll get an accurate result. Make sure that you read the instructions on your test carefully before taking the test. Some aren't as strong as others and require first morning urine. If you saturate the stick too much, you may fail the test, because you'll wash out the chemicals that give you a response. not enough urine, and you won't have enough HCG to indicate pregnancy. Before asking questions, please understand. I am not a doctor and I am not, myself, an indicator of early pregnancy. If you're having symptoms, the best thing that you can do is to test, when it's an appropriate time to do so. Listing your symptoms will not help me to tell you whether or not you're pregnant. I can, however, tell you if what you're experiencing sounds like a pregnancy symptom. Because I am not a doctor, I cannot offer medical advice and therefore believe that if you are having a crisis, you should see your doctor right away instead of asking for help on any internet forum. Thank you for watching this video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find lot of interesting videos on wide range of topics here. Stay tuned and keep watching.